Hi, I'm Dr. Neil Schultz, and this is Viewer Question Week at both BeautyRx and Derm TV. Welcome to the September 2013 edition of BeautyRx Live, where over live streaming video, I'll answer your questions about BeautyRx skincare products and related skincare issues. BeautyRx skincare products are the same patient-proven and award-winning products that have given my patients more beautiful, healthier, and younger-looking skin for over a decade. They stress the importance of color and texture, in addition to, of course, the important issues of lines and wrinkles. And now that BeautyRx skincare products are available to everybody, we're doing this BeautyRx Live so that people who don't see me in the office, but people who are buying our skincare products have access to me and can ask me questions about these skincare products or the issues that they're using them for. If you have a question, please go to BeautyRxLive.com and enter your question in the chat box, and I'll get to as many questions today as I can. And by the way, if our picture looks a little different today, YouTube has changed some of the parameters and some of the ratios of the picture, so you're getting a much wider picture today, and it looks like I'm much further away, and for me to get to the questions, you'll have to see me reaching to scroll in the computer. So let's get started with a question from Sally. Can I exfoliate dry skin, she asks. And the answer is, of course you can. Dry skin is skin that either feels like it's tight after you've washed it, or skin that appears flaky from all the extra dead cells. And of course you can exfoliate dry skin because the whole purpose of exfoliation is to remove those extra dry cells, those flaky cells. Now, if you have dry skin, though, you want to make sure, as always, that you use a skincare appropriate vehicle for your skincare product. So in this case, if you wanted to use a BeautyRx exfoliant, you would start with the Starter Strength Daily Exfoliating Therapy Cream, which is an 8% starter product, but you'll use the cream because cream is appropriate for the dry skin and not a serum. Again, I'm Dr. Neil Schultz, and we are on live streaming video on BeautyRx Live. If you have a question, go to BeautyRxLive.com and just enter your question in the chat box. Bob asked, I know we have to change products for the season. It just got cooler where I live, and my skin dried out right away. Do I need to change already, or is something weird with my skin? Bob, as soon as things get a little cooler, as soon as the humidity starts to drop, your skin may need a change in vehicle. So it's not weird skin. Everybody's skin is different. Some people need to change their vehicles earlier. Some people need to change them later. But again, you want to stay with the same active ingredients. You're just changing your vehicle. So you might be going to a cream after having used a serum or a solution during warmer, more humid weather. But there's nothing wrong with your skin if in the middle of September or the end of September, the weather changes are sufficient to cause your skin to reach out for a heavier vehicle. Christine asks, how can I really exfoliate daily? Won't it irritate my skin? Well, Christine, it depends on your skin type, depends on the strength of your exfoliant, depends on the type of exfoliant, depends on how you use it, and so on and so forth. But the bottom line is there are exfoliants which are sufficiently gentle so as not to irritate your skin when used on a daily basis. And one of the reasons I developed the technology in BeautyRx glycolic exfoliants was to get past the oxymoron of, quote, gentle exfoliation, because people think of exfoliation as harsh, and here I am saying gentle exfoliation. But if the glycolic is adjusted, and this may be a little technical, but if we're using a sufficiently high pH in the product so it's not too acidic, and put enough glycolic in, you're not apt to get irritation. So the answer is yes, you can find a product for chemical exfoliation, whether it's glycolic or salicylic or lactic. You can find a product for chemical exfoliation which you can use on a daily basis. Now, if you're concerned that you have sensitive skin, well, don't start daily. Start every other day and work into it. And test the product, as I often recommend, by just putting a small amount in front of your ear every other night on the skin in front of your ear, the size of a quarter or 2 or 3 centimeters. And if after a couple of alternate nights it doesn't irritate, then by all means go to every night. And if that doesn't irritate, then use it on your entire face. Again, I'm Dr. Neil Schultz, so we are over live streaming video on BeautyRx Live. questions, BeautyRxLive.com. Go to the chat box and I'll get to as many of them as I can. We have another question from Irene. Is there a benefit to using oils to moisturize the body rather than traditional lotions? Irene, if you want to moisturize, the word moisture to me conveys water. And moisturizing means increasing the water content of your skin. So traditional lotions that you're referring to are water-based lotions or lotions that contain water. And the purpose is for those lotions to impart water to the surface of your skin so your skin can absorb it and therefore not be as dry. That's what moisturization is about. Oils don't have any water in them. So if you're going to use an oil, then you're using really an old or traditional technique of increasing moisture, not by adding moisture, but by not allowing your own moisture to evaporate or escape. So you're using something occlusive like an oil or Vaseline or petroleum jelly to actually coat the skin so moisture, the normal moisture from sweat and from your skin cells, can't evaporate. Therefore, it gets thrown back into the skin, and that's how you then achieve moisturization. But that's limited by two things. Number one, you can't increase the amount of moisture that you actually have in your system because you're not adding any moisture. And number two, you're taking a chance on clogging pores if you're using oils, particularly on your back or chest or neck, which can be acne-prone areas. So I'm not a big fan of using oils to moisturize skin unless you have something that we call mature skin. And mature skin is usually found in people in their 60s and 70s. And not only is their skin, not only have their oil glands stopped producing oil or not as much oil, but the water glands aren't producing much water. The bottom line is they have a deficit of both oil and water. And when you have a deficit of oil, then it's okay to add oil because then you can't be clogging pores. But again, you still want to, at one point, add water. You want to add some hydration. You want to add something that gives you additional water. So why not try this if you want to use oil on your body? Take a sprayer with just some water in it and spray your skin to add some water to the surface of your skin. Then apply the oil on top so that oil can lock in the additional moisture from the additional water that you sprayed. I'm Dr. Neil Schultz. This is BeautyRx Live. If you have a question, go to BeautyRxLive.com and please use the chat box and I'll get to as many of them as I can. Talia asks, my lips seem to be perpetually chapped even though I use chapstick. Is there anything else I can do for them? Talia, one of the most important things I can tell you, and one of the things that perpetuates chapped lips, is very often when people have chapped lips, they go like this. They use their tongue to try to put saliva on the skin to moisturize their lips. But saliva isn't water, and saliva doesn't moisturize. As a matter of fact, you know what saliva does to your food? It dissolves it. And if you put enough saliva on your lips, it will disrupt some of those skin cells, actually dissolve some of them. And that just contributes to the chapping, because the chapping is not just dryness, it's actually irritation. And the saliva further irritates it, makes it more flaky and more chapped. So you get caught in that loop of, number one, you're adding fuel to the fire, and number two, you are actually defeating the purpose of what the normal emollients in your lips can do. So first of all, you've got to stop licking. Number two, if chapstick isn't heavy enough for you, then get some petroleum jelly, get some Vaseline, get some Aquaphor. These are heavier things than just a chapstick, which often have some mineral oil and also certain balms in them, but may not be heavy enough. Third, if that's still not sufficient, because despite the fact you're restoring the barrier, you haven't reduced the inflammation that's fueling the chapped lips, then you can get an over-the-counter cortisone ointment, not a cream, an ointment, and try that a few times a day. Ali asks, what happened to just dry, normal, or oily skin? It seems that everyone now has combination skin, which seems complicated to treat. Ali, that is a very, very insightful observation. As a matter of fact, I often say, I think that the new normal skin is combination skin, because so many people do have combination skin, which means in the T-zone you're oily and in the cheeks you're dry. And yes, it does complicate treatment because the vehicle that treats the T-zone is not going to be appropriate for the cheeks and vice versa. So what do you have to do? You actually have to, as you say, in a more complicated fashion, do your treatments perhaps with two different products for those areas, or just not treating the cheeks as aggressively since the cheeks are more prone to be dry and to get irritated. So I wish that there were an easy way around the complications of combination skin. Now, there are some products that are promoted as being appropriate for combination skin, but what that really means is you can use it either in the cheeks liberally or the T-zone liberally, but you're going to have to make certain adjustments in the opposite area because you can't treat oily and dry skin successfully with the same product. Christine asks, I've been thinking about getting a humidifier to prevent getting sick in the winter. Is this good or bad for skin? Does it depend on skin type? Well, Christine, in the wintertime, of course, humidity is lower, the temperature is lower, so your skin tends to dry out. So a humidifier, which adds more moisture to the water, can only help your skin. It can only help prevent dry skin. There are many people who just don't seem to be affected by it. But if you are affected by it, if you are affected by drier skin during the winter, then by all means a humidifier is good. But don't get a hot water humidifier. Get a cold water humidifier and get one that has a chamber that can easily be changed, where the water can be changed, and that can be rinsed out and washed easily because we don't want germs accumulating in that chamber. Just give me a moment while I check a few other questions. Okay, there's another question here from Amanda, which I've missed, and I would like to get to it. She says, I use a glycolic exfoliant nightly per your recommendation, but I still have dark spots. Is there something else I can do? Amanda, important because exfoliation is part of the treatment for dark spots, but not the only treatment. Necessary, but not sufficient. You need three things for dark spots. Number one, you need regular use of sunscreen. Even in the winter, you still have all the UVA rays that are the same all day long, all season long, and UVA rays contribute to dark spots. And the sun's UVA rays can cause darkness faster than our products can lighten it. So if we don't slow the process down at the beginning, we're not going to get there. So first of all, you need sunscreen every day. Of course, you need exfoliants, as you're using, to remove the extra layers of dead cells that have too much brown pigment in them, in the brown spots. But we also need to slow down the melanocytes, which are the melanin pigment-forming cells underneath those brown spots that are fueling all the brown, that are pumping up all that melanin pigment into those cells. So we need a bleach, we need an exfoliant, which you're using, and we need a sunscreen. You need to use all three. Use the sunscreen every morning. You can then use the bleach on top of the sunscreen. Use the exfoliant every evening. Then use the bleach on top of the exfoliant. BeautyRx usually uses hydroquinone-free bleaches like Brightening Complex, which is a botanical-based bleach, which does a great job of lightening hyperpigmentation or some of the pigment in brown spots. But regardless of what bleach you're using, try to use it twice a day. Ellie asks, now as it's officially post-summer, what should I do to check if I have summer damage and how should I treat it? Products, dermatologist, spa? Ellie, the first thing to do is to see your skin professional and get an opinion. Whether your skin professional is an esthetician or a dermatologist, certainly a dermatologist is going to be able to tell you whether there is damage either on the surface of your skin, meaning the epidermis has been damaged. That can happen in two ways. Either the skin becomes rougher and flaky, or you've got additional pigment, like we were just talking about from Amanda's question. And there can also be some damage to the dermis, where some of the collagen may have been degraded by the ultraviolet light, and that results in fine lines. You don't get deep lines in the course of one summer, but you can get some fine lines, which could also be helped with moisturization. But first you have to identify the problem to be able to treat it, so you need to see your skincare professional. And at that point, sometimes it's products. Certainly, Exfoliants are the most important thing in reversing summer damage, but moisturizers and bleaches are also very important. You know what that hot summer sun did to your wet bathing suit. It did the same thing to your skin. You need to moisturize. Moisturizers, bleaches, exfoliants, and of course sunscreen to prevent ongoing damage. In terms of procedures, certain spas do certain procedures. Some dermatologists do procedures to help reverse that skin damage. But first we have to see what you have to decide what you need. So this is the time. It's after the summer. Go get it checked out. I'm Dr. Neil Schultz, live streaming video on BeautyRx Live. This is the September 2013 edition. If you have a question, go to BeautyRxLive.com. Please use the chat box and I'll get to your question as soon as I can. Roberta asks, I used a sunscreen with an SPF of 100 all summer long. Now that it's the fall, I'm on the East Coast, can I use a lower strength? Roberta, of course you can. Using an SPF of 30 is sufficient, and definitely 50. Don't forget, once you get to 30 with an SPF, you're blocking over 96% of the damaging UVB rays. And when you get to 50, you're blocking over 99%. And there really is no difference between a 50 and 100 in blocking UV rays on a conventional basis, with one exception. One of the reasons that sunscreen fails is because people often don't use enough, particularly with traditional sunscreens which have UVB blockers in them. If you don't use enough sunscreen, the SPF protection you get, which is the UVB protection, falls by the square root. So a 16 becomes a 4, a 50 becomes a 7, and a 100 becomes a 10. So if you're not using enough, well, that 100 will be a 10, which will then give you 75 or 80% protection. But this is the bottom line. You don't need to use a sunscreen with an SPF of more than between 30 and 50 in any season. Just apply it every day, reapply it every 2 to 3 hours or immediately after you swim or sweat, and reapply it on a regular basis. You don't need to use an SPF with 100. Harriet asks, I purchased your protective vitamin C serum. I love it. I know I'm supposed to use it at night, but can I use it? Also use it during the day in addition to at night. Of course you can, Harriet. It leaves a lovely finish on your skin. It leaves your skin with a nice texture. There's no harm in using it during the day. If you do, it will then just become an additive sunscreen as opposed to an antioxidant. And during the day, since it has some green tea in it, that will act as an anti-inflammatory agent. But at bedtime, it works best because that's when it has time to penetrate into the skin. So it's in the cells where it needs to be to act as an antioxidant the next day. But if you use it twice a day, all to your power. Sandra. Hi, Sandra. Sandra's 42 years old, and she has combination skin. What types of products should you consider using? Well, depends what you want to accomplish. Again, you know, I believe that the 3 daily essential skincare ingredients are sunscreen, exfoliant, and antioxidant. So for sunscreen, for combination skin, the Maximum Solar Protection SPF 50 Sheer Sunscreen from BeautyRx is a great sunscreen to use. In terms of your exfoliant, if you're new to exfoliants and you have combination skin, I would start with the Daily Exfoliating Therapy Serum every night. That's an 8% serum. And then after 2 or 3 weeks, add the Advanced Exfoliating Therapy Pads, which are 10% exfoliant. And I would use the Protective Vitamin C Rescue Serum, which is a topical vitamin C-based antioxidant. And those are the 3 essentials. If you need moisturizer, Nourishing Moisture Cream for evenings would be fine for combination skin, as would Replenishing Moisture SPF 15 sunscreen be on days when you don't want to use an SPF of 50. But these are all perfectly fine products to use for combination skin. You might consider at the age of 42 either Refreshing Cleanser or Balancing Cleanser, but I would use the Clarifying Toner, not the Purifying Toner, again because of your combination skin. Marnie asks, how do I know which order to apply my products in? Marnie, this is one of the most confusing products in all of skincare. The reason it's most confusing is because there's just no consistency in the answers that you often hear from different professionals. So doctors find it confusing, estheticians find it confusing, patients find it confusing, and even some beauty editors find it confusing. The easiest way to figure out what to do, if you're using BeautyRx products, it's not a problem because I have a number system, and that number system is the RX number on any product. And when you're using several BeautyRx skincare products, you just go from the lowest number to the highest number. So an RX number of 17 goes before 50, and that goes before 120. If you're not using my skincare products, or if you're using my skincare products and other skincare products, or just other skincare products, the general rule of thumb is that we go from the lightest vehicle to the heaviest vehicle. You put on the lightest liquid first, and you put on the heaviest cream, lotion, or pomade last. Go from lightest to heaviest. Well, thank you very much for joining us today on BeautyRx Live, September 2013. Please keep sending in your questions to Derm TV. So many of these episodes, so many of our questions come from those questions which are really, really important. They make great subjects for episodes, and I'll see you next month on BeautyRx Live, and I'll see you tomorrow on Derm TV.